Recording.
Medic 2, you were needed for a 17-year-old who was involved in a moped accident in the Regent Heights subdivision. Bystanders state that two mopeds were playing chicken and collided. Okay. Upon arrival, you find your 17-year-old patient laying supine in the middle of an intersection. There is a small moped laying about 10 feet away. No helmet found. You were 10 minutes from community ER and an hour and a half to the trauma center.
Okay, so I'm wearing PPE. Is my scene safe?
Yes.
Okay, so it's a mechanism of injury. One patient. I'm gonna go ahead and call additional EMS, and then I'm also going to consider C-spine. I'm gonna go ahead and plan on doing that. Okay, so moving on, we get there, and my general impression is I have someone laying in the middle of the road.
Not moving.
Not moving. Okay, and then, I'm sorry, what did you say? Did you say if they were talking or not?
It does not say, but he is alert to voice.
Alert to voice. Okay. So that is the level of consciousness. Chief complaint is...
Doesn't voice a chief complaint, but altered mental status is evident.
Okay, so altered mental status. Airway. It's not talking, so if I open their mouth...
It's patent.
It's patent, okay. So then there's no need for an adjunct then. So moving on to breathing, what is their, is their breathing adequate?
It does not say, so I would go with yes.
Okay. What about, okay, so that's adequate. What's SpO2?
96.
96. Alright. And then, is there any... Can't think of what the other one is. Okay, I'm not sure. So circulation, is there any major bleeding?
No external bleeding noted.
Okay, and then what is the skin color?
Warm, pink, and dry.
Okay, if I check the pulse?
112.
112, okay. And then, warm, pink, dry, 112. Shoot. No bleeding, you said? Okay. Never mind, that's secondary. Okay. So I would go ahead and, I would probably want to go ahead and, personally, I would say pack up and move on, get them loaded up and move them to the hospital. I would want to get them going as priority since there's the altered mental status. I wouldn't want to stay there. I would do the secondary in the ambulance. So then for vital signs, okay. If I'm looking at the pupils, what do I see?
Sluggish and slightly unequal.
Okay. Well, that's not good. How about for if if I'm looking at blood pressure,
122/76.
okay, 122/76, and then what are my lungs sounding like?
Clear.
Bilaterally, or
Bilateral.
okay, and then how about heart sounds, heart tones?
What do you want? Sorry.
Heart tones.
It does not say.
Okay. And then I feel like I'm missing something. You said SpO2 was 96, right?
Yep.
Okay. And then what's their ventilations like?
Per minute.
Yeah.
24.
24? Okay.
Yep.
Alrighty. So then, sample, did you, signs and symptoms was the,
She doesn't have any, so
okay.
Go with them.
Allergies are probably,
unknown.
So then medications,
Unknown.
okay, pertinent medical history.
Unknown.
I gotta ask because I'm on camera. And then last oral intake.
Unknown.
Events leading up was playing chicken. And then moving on to primary. If I palpate the head, do I have any contusions, lacerations, any abrasions?
Softball-sized compressed skull deformity in back of skull.
Nice. Okay, do I have any CSF in the ears, anything like around the eyes, nose, mouth?
No fluid from ears, eyes, nose.
Ears, eyes, nose. Okay.
No fluid.
No fluid. Okay.
Got it.
Got it. Do I have how about the eyes? Like anything at all with the eyes?
Sluggish and slightly unequal, facial bones intact.
Okay.
No fluid.
Okay. So, we're moving on to the neck then. Like I said earlier, we are C-collared. Is there any JVD?
Slight JVD.
Slight JVD, okay, and that is because they're laying down. Okay.
Yep.
How about C-spine?
No cervical deformity.
Okay. And then trachea placement or
Midline.
midline. Okay. How about any tenderness?
None noted.
Okay. Anything I listed above? Any abrasions, contusions? Okay. How
noted.
None noted. Okay. How about chest? Any bleeding, lacerations, contusions?
No injuries noted.
Okay. And then moving down to the abdomen and oh, okay, hang on. Going back up. I forgot to listen. If I auscultate,
Clear bilaterally, diminished in bases.
diminished in the bases. Okay. Well, I don't remember what to do with that, but I auscultated. Moving on. Abdomen and pelvis. Do I find any problems there? Any contusions, lacerations?
Soft, non-tender.
Okay, and then how about the lower extremities?
No injuries noted.
Okay, And the upper extremities.
No injuries noted.
Okay. And then the posterior, lumbar, and buttocks, and tail.
I'm gonna go with no injuries noted because it's not on here. Oh, just kidding. No injuries noted except abrasion to left scapula.
To the left scapula?
Yes, ma'am.
Okay. Abrasion, which is probably just from playing chicken. Alright, so then at this point we would manage the secondary wounds appropriately, which, I mean, the secondary wounds would be, yeah. So manage the secondary wounds, and then we would just reassess every 5 minutes. And that is, I think, everything.